first thing, agenda adjustments. I do have one adjustment I would like to make. I would like to ask, so with agenda adjustments for new folks, by policy, it does require a vote. I would like to add an executive session. I would like to add, let's see, 10.1, which would be a motion to enter an executive session pursuant to 1 MRSA 4056D with the business manager and the director of CAI for Regional Schools United 4 Education Association, MEA, NAA, Educational Support Professionals Negotiations.
So moved.
Second.
All right, so we've got Bob and Joe. All right, actually, all those in favor? Motion carries. All right, so we will add that as 10.1. All right, so the first order of business tonight is the election of the chair of the RSU4 school board. So at this time, I will open up the floor for nominations for board chair.
I nominate Bob English, if he's willing to accept.
I will accept.
Nominate Robert Gate. I won't accept.
You won't accept? Okay. All right. Just make my notes here. All right, do I see any more nominations? No, at this time I call for a motion for nominations to cease.
So moved.
Okay, second for that? All right, thank you. At this time, Bob, will you accept that nomination?
Yes.
Yes, okay. So to vote on the chair of the board and the vice chair, it does require a roll call vote, so I will do the roll call now. Joe?
Yes.
Christie?
Aye.
Jen?
Yes.
Vicky?
Yes.
Robbie?
Yes.
Scott?
Yes.
And Bob?
Yes.
All right, at this point in time, Mr. English will take over as board chair.
Hey, that's easy for you. I have to be on your side.
First of all, thank you for your confidence. I look forward to your support again this year, as it will be needed from time to time. At this time, we'll do the election of the vice chair. I open the nominations for vice chairman.
I nominate Robert Gate.
Nomination for Robert Gate, is there a second?
Second.
Are there any other nominations? Seeing none, then do we really need a motion to cease nominations? Well, I just think we just nomination cease since there's no others. Robbie, do you accept the nomination?
Yes.
Okay. At this time, then we'll call for the roll.
Right, let's see. Joe?
Yes.
Christie?
Yep.
Jen?
Yes.
Vicky?
Yes.
Robbie?
Yes.
Scott?
Yes.
And Bob?
Yes.
Motion carries. Thank you so much.
And we're gonna get into committee here in a second. I'm extremely pleased, Robbie, if you volunteer for the facilities again.
I will.
With the project that's
Yep,
ongoing.
I will.
And your knowledge.
Yep.
Would be very beneficial. So I don't know if something was sent out, or maybe because we had this meet a little bit early, but normally we ask members to go and think about which committees they would like to serve on. I think, Christie, when we met, we talked about that at that time. The rest of us have been on a committee or committees, and if you're willing to continue on those, that makes that easy. Scott, have you thought anything about which committee or committees you would be willing to serve on?
I think I could run some insight on the technology.
Okay, so the technology, and that's also curriculum assessment and instruction. So they meet together.
Yeah.
All right, super. So how's that gonna make our committees look? Are we have one that only has one member, or, I know we have a couple of people missing, don't we?
We do.
Yeah.
Typically, we always have somebody who typically serves on two committees.
Yes, currently I'm on the CAI and Policy and Personnel, and Joan is no longer, and Stephanie, used to be on policy and personnel as well, so that's why everybody was
Yeah,
like,
I'm
Jen, come to a job interview.
So Vicky will sit in there.
Perfect,
And Robbie sat on two as well.
I'm on facilities and finance and curriculum,
yeah.
so.
Do you still want me on facilities or not?
It's, if you wanna be on facilities, we can always use the
Oh, yeah,
knowledge,
absolutely.
the knowledge and the insight that any board member brings to these committees. I wouldn't short. Only reason I wouldn't want, let's say, 6 or 7 people on one committee, then we'd have board meetings.
Right.
And then we have a trouble issue there.
How many is on facilities right now? Just
Joe
Rob.
was on facilities, Vicky.
Joe, Vicky, and me.
Okay, good.
Yeah.
All right, so that's finance facilities. Personnel is Vicky and
And me.
Jennifer.
Yeah.
And me.
Christie wanted
And
to-
Christie? All right,
Good,
super.
Good.
And CII Technology, Scott,
I'm on that as well.
you're on that, and Robbie?
Yeah.
And Andrea and Dory as well.
Andrea
Yeah.
and Laura were both on that committee.
I can
Okay.
come off. I'll come off if there's too many because of where, that would make 5.
Yeah.
so
Yeah, that would be too many.
That would be too many, so I'll come off that one.
Okay.
All right, so we got that captured?
I'm sure I'll have extra meetings in facilities when we get cranked up.
I'm sure you will.
We've got a lot coming.
All right, but I thank you all for being willing to go and serve in these important positions. At this time, we'll move on to 3.1. I'd like to entertain a motion to approve the minutes of the June 23rd, 2021, and June 30th, 2021 Board of Directors meetings.
So moved.
Moved and seconded. Any discussion, corrections? No comments? Okay, seeing none, I'll call for the vote. All those in favor? Opposed? Abstentions?
I wasn't here for most of it, so.
Right.
I read the minutes, but I'm not sure if I'm told enough to speak about it.
All right, that's fine. So I'll go off of that option. Okay. Petitions and communications, 4.1, to elect a local delegate to the MSBA Annual Delegate Assembly.
So I didn't put this on as an action item for this board meeting.
Okay,
I
all right,
thought-
so it's just local. it
Yeah.
doesn't say-
Just,
Okay.
yep, I just thought it might be worth a conversation, especially for our new board members, about what this is. And then at the next board meeting, we put it on as an action item. So, I don't know if you wanna talk about it, Bob?
I can. So yearly, the Maine School Board Association and this Maine School Superintendents Association have what used to be a 4-day conference, the first being superintendents and the next 3 being school board, and the superintendent's voice there too, making sure the school board members didn't get out of hand. But it's a opportunity. I believe this year it's gonna be remote again. It's gonna all be online. But it's an opportunity which in some ways is really beneficial for someone who's just interested in attending a few of the seminars.
Yeah.
You know, you can log in for your seminar, you don't have to be there all day. It used to be at the Civic Center, they put on a nice lunch, have a keynote speaker, which they are having a keynote speaker this year as well. I don't know if everybody got the email from Maine School Management about the delegate conference.
Our new members will get it soon, once they're registered with MSBA.
Right. So, but it lays out the agenda, and they'll get more information about all the different seminars. You can register for door prizes even though there's no door. Used to go around and fill your little goodie bag with pens and paper and things that the different vendors were offering. And there was a real, I found that the ones I've gone to, and I think I've been to 3 or 4, were helpful to me, especially visiting some of the vendors and what some of the products that they had to go and offer and services that they made available to the schools. The seminars were extremely beneficial if I could get in the ones I wanted to, which typically I could. The only conflict I ever had was wanting to go to one when I had to go to the delegate election or assembly to vote on bylaws and changes. They always seem to have the best ones then, but I would encourage anybody that would be interested, think about it, look it over, and if you have the ability, I think this is probably gonna be a Friday and Saturday deal this year. All right. Because it's contact the superintendent's office, let them know that you'd like to be a delegate. We need to have one voting delegate. Well, yeah, we elect one voting delegate who's supposed to go and vote at their meeting, which obviously would be online again. And they vote on things that the school board association wants to promote to the legislature or to the community. So, I just recently received a copy of what those items are. I don't know, I think everybody gets it.
Yeah.
I think
Yeah,
it's
and
supposed to-
I will
They're
be sending
online.
them out this week as well.
Yeah.
Okay.
I don't know that I agree with all of them, but that's just me. I would hope that whoever our delegate is that meeting before, so that those things come up and we discuss them and decide what the position of the school board is as a whole. You're going to represent the school board and not your individual self, all right? And cast the vote on behalf of the board. So give us some thought, check out the information, see what's there. Probably doesn't cost hardly all that much this year, since I don't have to pay for the civic center rental and stuff like that, so, okay? That's it. I don't know if anybody else have anything to ask?
The only thing I'd like to say is that they have a lot of interesting seminars, like on school law, which is put on by Drummond and Woodson, our lawyers, negotiations, hot topics that might come up, in past school years and stuff like that, so it's really beneficial.
It is, especially if you're new to this arena.
Yeah.
It's really
Yeah.
informative, and you get to really network with people and ask questions.
Yeah, it was a lot nicer when you could go sit and have lunch at the
Yeah.
and talk to other board members and, yeah.
They came down from all over the state.
Yeah.
Loads of them coming
Yeah.
down from up.
I mean, I've been on both sides,
Yeah.
and as a superintendent and as a school board member, I was actually, Bob and I were both delegates one year, when I was on the school board in 49. And Bob's correct, it really gives you, probably two, Jim, it gives you an
Yeah.
eye-opening experience as to, there's a lot of education involved. The delegate assembly is a little interesting, it's about an hour out of the day where you take some notes and there's a lot of talking, but it's a worthwhile experience if you've never done it.
Okay. And we'll move on, superintendent's report.
Yep, so, short report tonight, but, so we're in the phase of hiring at this point, so you're gonna see on the next agenda a slew of things to approve with regards to hiring. We do have 2 teaching openings left to fill, we've got quite a few ed tech positions open, and Scott, I believe we've got some food service and custodial positions.
That's correct.
We're working on those
Yes.
currently. Yep, all in all, I've met with candidates, we've got some fantastic people that we've hired over the summer, so I'm excited about what they're gonna bring to the district. I would say the moves across the district went well, we made a major move this summer. I gotta give Glenn a lot of credit. I mean, he coordinated a lot, our administrators coordinated a lot, and we got things moved, in short order. Literally at the end of June, things were done.
Having that extra 2 weeks made a big difference.
It made a huge difference, it really, really did. So, I'll be touring buildings next week, typically, next week before school starts, 2 weeks I start touring buildings to see the condition, but those, I've been in all of them, they look fantastic.
They
They
do.
really do, you walk into this building, it looks really good, so, I'm really happy, our custodial staff does a fantastic job taking care of our buildings, and every year it just gets better and better. More time always helps, for sure. Just an update on the architect, I did sign a contract with the architect. Scott and I met with the architect 2 weeks ago.
Yeah.
Boy,
I know.
time is running together, but we met a couple of weeks ago, they're getting ready to get started, they've asked for some of our blueprints from the middle school, our DEP permits, things like that, so they're working on that piece. They'll be coming in probably at the end of the month to start meeting with administrators about programming, and then they will meet with staff. They're gonna pick some staff out to meet with, to talk about what they would like to see in our building, or in this new building. So, all in all, I was really impressed. I don't know if Scott, if you wanna add anything, really impressed with Kathy and Alan and what they're gonna bring to the table.
They're squared away.
Yeah.
I mean, all the references and things that they've said, we've gotten, I'm very comfortable where we are, and we'll see what.
And for our 2 new members, we've contracted with CHA architects, so we went through a competitive process, interviewed architects and picked them. And like I said, they do fantastic work. So if you guys wanna see any of the work they've done, more than happy to send it to you. They had packets that they submitted when they answered our RFP, so I can get those to you if you'd like it. But I'm excited what they're gonna do for us in general. As you all know, the CPT team met on Monday. We'll be hearing an update from that, and Kathy will do that. And the audit was done the first of July, first week of July, right, Scott? We finished the audit.
Yes.
Yep, and I think, I don't wanna speak for the auditors, but I think things look pretty good, so.
Yeah, when I met with them, they were pretty pleased.
Yeah, so.
Are they gonna come visit us again?
Oh, they will.
Oh, yeah.
Yes.
Hank will
No, I
come
mean,
visit.
just
Yes, they,
good.
by law, they're supposed to.
Yeah, they
yes.
have to. So we usually do that in October, I think.
Yeah.
We're paying for it,
Yeah,
Ken,
so
so.
we,
Yeah, I know.
we do pay for it.
He
It's-
always likes to do this to us.
Yeah.
So one time when I wanna tell everybody, tune in, just
Yes.
tune in.
Well, I don't, just don't wanna say anything, but when I first started here, a few years ago, it was like, okay, we'll do you last.
Yeah.
Now we're the first ones.
Yeah,
That in itself
yeah,
says something.
that's what's volumes, yes.
Yeah, I met with them a couple of times and they just couldn't say enough about the work that our
Absolutely.
staff and central office do to keep things straight. So-
Everybody.
And our administrators and their administrative
Absolutely.
assistants, just all of it has really come a long ways, even in just my 5 years as superintendent, so,
Yeah.
or 4 years, sorry.
Mhm.
Time gets away from me. Scott.
Hank will tell you the old days when they used to just get a box of receipts.
Oh, yes.
Other than that, I don't have any appointments tonight, but I do have some resignations. Sarah Radash, grade 4 teacher at CRS, Karen Bailey, custodian SPS, Patty Gordon, librarian/teacher at Oak Hill Middle School, Marie Curran, food service at Carrie Ricker School, and Jessica McKenzie in Ed Tech 2, Untitled School. That concludes my report.
All right, any questions? We'll move on, we don't have any other reports that are coming on. And somehow, I think 5.7 is actually supposed to be
Yeah.
3.1 or something.
Yeah, that's right.
And reverted back to an old copy of the agenda, so. Public comment, I apologize, the public, we should have opened it up to you right after the reading of or the approval of the minutes. We will do that at this time. So this is an opportunity when members of the public can have the floor and speak on issues pertaining to the school system. It is not a time for members of the public to come up and identify or a particular staff member or student with an issue that should go through the study. So we don't allow for comments that are derogatory in nature towards an individual. All right, that's not what the public forum is for. So it is for comments about the education system. If you want to recognize a staff member that did a great job, that's a little bit different. Those we allow. It's kind of like a two-sided coin. You can say good things, but not the bad things. And so we have we have a number of people joining us on Zoom. All right, and so we would ask those who are on Zoom, we don't turn it on everybody, you can put in a chat, superintendent or Kathy, somebody is monitoring that and will read those or recognize the individual who wants to go and speak, to go ahead and speak. Or you can raise your hand, not the clap sign, but I think it's under participants down at the bottom, there's a little thing that says raise your hand. You raise your hand that way so that you can be called upon, all right? And at this time, we will open it up. I will say one other thing. It has been the practice of this board, even when other members have been chair, that during issues that are mentioned later in the agenda, when we talk about an item that, for which there may be a desire for the public to speak, we allow that to happen, but that is typically after the board is pretty well finished discussion, and we'll let the public briefly have a few minutes to go and address what we've spoken about, and then the board members will once again just wrap up any things that those comments may have brought up for us, and then the board will take whatever action is appropriate on the item. So that I plan to continue. That way, it's hard to go and speak. We're gonna talk later about the CPT update. It's kind of hard to make comments ahead of time. If you don't know what that update is, you might find that you wanna make a comment about what the results of that, or the recommendation that was made, is. So, I think that's why we've done it, and we plan on continuing doing that. So, anybody in the audience would identify anybody on Zoom to identify who they are and which town they're from, just like if they were here in the room. We would know who it is that's speaking, and anybody in the room, we ask you to come up and use the mic, even though we might hear you, you have to remember this is being broadcast. And so the microphone allows the people out on the internet, either on our streaming site or on Zoom, to hear what you're saying, okay?
All right, so I do have a Samantha on the Zoom that has a question. So Samantha, if you're there, you can unmute yourself, and we've got you on the speakers. Now, she asked a question, so I will read it.
Okay.
Are our children in kindergarten going to be required to wear face masks?
Okay, so I guess the other thing I forgot to mention, this is usually, this period is for you to make your comments and discussions, it's not a back and forth. However, for this one, I will go and provide that answer. That is gonna be discussed, under 7.2, 7.1 and 7.2. And so, we'll wait to then and hear what the recommendations were from the CPT team. And if the board needs to take any action to modify what the plan for the fall was that we approved in late spring. All right, so Samantha, that's where we penned on that. So again, this is comments, this isn't a time for an exchange back and forth. I'm sorry, I wasn't clear on that.
I don't have anything else at this point.
So nobody else have any comments?
There's a question, comment from Natasha. Natasha, would you like to speak? I think you can unmute yourself and speak if you'd like. Okay, I can just read her comment then. She said she would ask if we could discuss at some point about doing early release instead of late start.
Okay, so we can kick that off for a committee to think about that, because that takes a lot of discussion, not only with us, but with the association. So, it's certainly something that, everything is open for discussion. So we'll take that under, notes are being made, so that that can be looked into, and at some point, if it's decided that that is a viable option, it would certainly come to the board for consideration.
Well, do you think that should be sent over to CAI?
Well, that's who I would think would be the appropriate committees to look into it, just to see what they think about it, and it's certainly that there's a lot of other things that would have to be involved in that too. Okay, there's no other comments? All right, then we'll move on to 7.1. This is a CPT update.
Great, so as you all know, the collaborative planning team met on Monday. If you aren't all aware, those videos get posted on our website, so they are there to be watched. I think it was up probably 15-20 minutes after the meeting. Pretty quick turnaround. We've gotten pretty good at recording Zoom and getting it up pretty quickly. So did meet on Monday. There's, as always, as with the situation we are all living in, there's ebbs and flows to what goes on. The executive order has been lifted, things are now recommendations, so we had a pretty lengthy, I would say 2 hours on Monday. We talked about some changes potentially to the plan, so I will turn it over to Kathy to talk about what the CPT looked at on Monday.
Yeah, so after the board makes the recommendations or the approvals, we'll make this PowerPoint presentation to a one-sheeter to then communicate it out to parents. So for this purpose, I just want to make sure you understand the whole process. So as Andy alluded to, that we are no longer under executive order as of July 1st, which means that we have to follow the CDC guidelines, but the DOE has no longer the ability to mandate things. So until another executive order happens, right now they're currently recommending A couple of differences going forward this year compared to last year is they will no longer color code the counties. So the US CDC has a map of the entire United States, and our color coding, and their color code system was different than Maine's, so it's like a 5-point or 6-point color code system. It actually changes daily. So for example, today, Androscoggin, we've had 27 extra cases since the weekend, and we actually went up in color, so just severity, where Kennebec County is in the moderate. It's one of the 3 counties, even though Kennebec County actually has more cases than Androscoggin at the time of the differences. So I'm not quite sure of the formula. We did ask those questions, and they are working on figuring out those nuances of how the color coding happens. However, the color codes on the US CDC does not affect the main DOE's recommendations and plans at this time. So that's a little bit different going forward. So when the CDC, I've met with Dr. Shaw at the end of July. I've met with the commissioner last week and even today. They are currently looking to update the standard operating procedures, and usually that is the document that the CPT kind of makes those determinations of changes to the plan. The SOP has not been changed or updated since May 13th or 15th, I have to go back and look. So we're looking to have those recommendations. So the plan that we have here is based on the recommendations and the changes that we've had over the summer. But know that this is a fluid plan, and our process for those of you that are new to this is we usually, the board approves a plan. If there's new recommendations or mandates, the CPT team meets again. They go over what does that impact or mandate or recommendation happen for RSU4, and then we bring it back to the board. So that's kind of our process, and that's how this presentation happened. Okay. So during the week of July 26th, the Maine CDC sent information to schools regarding what they considered the expectations for the fall. They had 4 that they're pushing. So last year at this time, we talked about 6 mitigation strategies and mandates, right? Recommendations was not used, it was more requirements. That's different this year without the executive order. So they're trying to push 4 different mitigation strategies that they want schools to really consider. So these are kind of the topics that we'll discuss in our plan. The first one is the new recommendation on universal masking. If you look at it, obviously in the last couple of weeks, the Delta variant has affected students, especially younger students. So they're recommending universal masking at this point. And they are recommending it in areas that on that map, as I talked to on the US CDC, if you're in a certain color, that's where you hit universal masking, not necessarily universal masking for everybody. All people on public and private, and for us, we are considered that, school provided transportation are required to wear masks. And part of that is the distance, and it's still considered like an indoor area. That is a mask mandate from the US CDC order, not through the DOE. So when we made the change of unmasking during summer school, we still continue to have masks on our school buses. They're pushing the vaccines, so that is a way to reduce the spread of COVID, and they're encouraging anyone that's eligible 12 and up to get vaccinated. There is potential for 6 through 11 to be approved of a vaccine. When that happens, RSU4 will have a pop-up clinic, one in Litchfield and one in Sedatus, and we'll make sure we bus kids over or do what we need to do to make vaccines available to our students and community members. The last one is pool testing. This is one of the things that we talked about in the spring. The board at the time decided to not support pool testing, but we'll talk about that a little bit more in tonight's presentation. So let's talk a little bit about masking. So it's recommending universal masking in schools. Tonight we are suggesting a color code system for RSU4, a color code system that would color each school. So we would not make a determination at a sweeping decision about masks At the district level, it would be based on schools. And so we're really talking about where we're taking the recommendation of when your cases are higher, that's when you need to implement your mitigation strategies. And so if the cases are going up, we would have students wear masks. When the cases are low in those particular schools, then it would become a parent choice. And we'll talk a little bit about the color coding system in a minute. Regardless of our color code, it is still required if students are taking RSU4 busing, they have to have a mask on. That is not a choice. Again, vaccinations, we are going to be having to do a report monthly and report to the DHHS about how many of our staff members are vaccinated. We are going to, when school starts, we will be asking our staff to complete a poll to get that data, and we will be posting it on our website as well. So the data that we provide for DHHS will make it available for our community members.
And that will be done anonymously?
Yeah.
Yeah, we'll do that anonymously. Basically, the way that metric works is we will put out a survey the staff, they will answer the question yes or no, or and if they choose not to, they're still included in the total number. So if we had 100 staff members and 30 responded yes, and nobody else responded, our number would be 30%. So,
And we are not requiring our staff to be vaccinated, we're literally just asking them if they are for this report. We will, throughout the year, offer services like pop-up clinics. We'll share resources on our websites, and we'll post our vaccination rates on our website as well to keep our community members aware. Pool testing. Pool testing, for those of you that don't know much about pool testing, it's pretty much a team of 3 people that come into each classroom and have all the students that had permission, parent permission, to participate in pool testing, have a COVID test, so it's a PCR test on one day. They swab the nose, and all of the kids in that pool would go into one vial. We would then mail it off, and if there was a negative test, then we're good to go. If there's a positive test in that vial, then the kids, students would still come to school. No one has to quarantine. We would then have the kids come to school and do a rapid test on all students in that pool. Depending on the color of your county, depends on how big your pool test is. So maximum 25, but if we are in a high area of transmission in the community, they do a pool test of just 5 students. So we can then narrow down where the positive case is. The student or the staff member that is positive would go home and quarantine, just like they would do for the regular CDC. All the other students and staff would continue to go to school. In order to have the no quarantine component of pool testing, we have to have at least 30% participation. Yes, you can hear me, so back in the spring during our actual fall plan that was approved, pool testing was voted on to not participate. But because it was another recommendation again, I wanted to make sure that we brought it back to the board. So our mitigation plans. The collaborative team, which includes students, teachers, admin, parents, board members, meet regularly to review updates, and will continue to do that this year. We will make the changes necessary based on recommendations or mandates that come from Maine CDC or the US CDC. And all these recommendations will come back to the board. We're suggesting that each school, so not the district, each school will have a color code system. Each school will be identified as green, yellow, or red to let the stakeholders know which part of the mitigation plan that the school is working on. This color system will help administrators, students, and parents and teachers know what the expectations are, including mask wearing. In addition, we also have a color code system for individuals for symptoms. So if they are symptomatic, we actually have a color code system as well. We know that we were sending kids home for very minor symptoms last year, and we are trying to mitigate that. We are trying to start a color code system to keep kids into school a lot longer. And so we're going to talk about what are some of the things that we can do this year that we've learned from last year that will help do that. So let's just talk about the school level plan. So a school that is in the green category is a school that has 0 or 1 positive COVID case in a 10-day period. Will follow the green mitigation plan. So every 10 days, this will be updated. So we will have that color code system updated on the website, and will also be communicated through our Infinite Canvas shell point system. If we have a school that has 2 or 3 positive COVID cases in a 10-day period, they will follow the yellow mitigation plan. If a school has 4 or more, which is now 3 or more is considered an outbreak in a school. You need to know that we only had 1 school that was very close to getting to outbreak status last year, just 1, at one point in the school year. So to get to red, if we look at last year's COVID, I know the variants are gonna be very different, but we wouldn't have had anyone in red as of last year. So if they have 4 or more, CDC gets involved, and at that point, we would have to follow the red mitigations. Most of the time, the CDC will have us be remote for a 10-day period, because that would be considered outbreak status. There are also times you need to know that there might be some grade levels, not the entire school, that could go into the red designation due to lack of staffing or quarantining. So let's talk a little bit about the details of each of those. So while the school is in the green category, masks will not be required. We are still following the guidance from the CDC that they're recommended for unvaccinated individuals, including those under 12 or those who are chosen not to be vaccinated, to wear face coverings only indoors. Masks are not required outdoors. Masks are required for any use of school transportation. Physical distancing. So this is one of those top 6 that were last year. Through the information last year, through all of the studies on COVID, they've realized physical distancing, although it is the one mitigation strategy, it is not the one that actually is effective in terms of in schools. It wasn't changing the fact that kids couldn't be into schools. So we will pay attention to where physical distancing is possible. To the greatest extent, we'll try to encourage that during our learning environments. Just as we did last year, our hand hygiene and disinfecting practices will continue. However, if we move to yellow, yellow would require masks to be worn indoors regardless of vaccination status and on school transportation. So this is right before we're getting to outbreak status. We're asking everyone to wear a mask to make sure we're not in outbreak status and have to go to remote learning. So if we're in the green category, it's a parent choice. Once we're into yellow, we are now in universal masking. Masks would not be required outdoors. Again, physical distancing where possible. Classrooms that had a student with close contact with a positive case would still be able to attend school, will be given a symptom check. So in the past, we've had just parents do that. If students have been identified as a close contact, we would do a symptom check, we would do a temperature check, and we would pod our students when possible. We are also offering that we can test students at school using the Binex Now, which is the rapid test, after 3 to 5 days after the last day of exposure. That would be parental choice. We would be calling each parent before administering a rapid test. Hand hygiene and disinfecting practices would continue as well. If we are in outbreak status, the CDC would put us into remote learning. We would have students bring home their devices and they would access their learning platforms such as Google Classroom or Seesaw, depending on the child's grade level. Red designation would only happen if we're seeing an increase of COVID cases or lack of staffing due to quarantines. I think it's important that you understand that we're not using the word hybrid here. I think the CBT had a nice conversation about that. We're not suggesting hybrid. We are only suggesting we are looking to do 5 days in person, face-to-face instruction. At only point when we get to the red status that students would be in a remote setting. and that would be for the 10-day period only. So I just mentioned that we would be offering rapid testing. That is something we didn't offer last year. We done the application, which got accepted
Yes.
yesterday.
So part of that is tests like the COVID-19 test, strep tests, things like that, are technically supposed to be done in a place that has a laboratory, but CLIA, which is part of DHHS, has allowed public schools to apply for a waiver. We did apply for the waiver. We were granted a district waiver to be able to give the Binex Now test in our school health offices across the district. You know, I look at it as, again, that you guys will take a final vote on that, but I look at it as an opportunity to provide a service for our communities.
So rapid testing would be for those students or staff that would be deemed as a close contact, or individuals that are exhibiting symptoms. Parent permission would be required prior to administering the testing. Contact tracing. Last year, our contact tracing, all the way till about May, was everyone in the classroom. Around May 13th, that's when it was determined that we could do a 6-foot bubble around a person that was positive. The CPT team at that time felt like we were just going to continue to do the classes. At that point, vaccination rates were going up, and we really didn't want to change the practice for the rest of the year. We did decide to revisit it as a CPT team for the fall, and we did, and are suggesting that we use the 6-foot bubble. That means when we have a positive case, instead of having a whole classroom, we might only have 2 students versus up to, so sometimes when we had a positive case, we could put 2 kids in, we could also put up to 90 kids in. And so by doing a 6-foot bubble, obviously it depends on what grade level and how much exposure they have to other students and staff, but again, it's a 6-foot bubble for more than 15 minutes. So we kind of played the tracking game May through June, myself and the nurses. We kind of actually tried to even out, say, how hard would this be to do the 6-foot bubble, and we were able to do that, and it did reduce the amount of kids that were being put into quarantine. So again, we would be suggesting to identify students within that 6-foot bubble. So the individual plan. So when we're talking about green, this is a student or a staff member that is not exhibiting any symptoms. The individual does the screener in the morning, they feel good, and they can come to school and follow the school level designation. So they might be feeling good, but the school might be in yellow, they would still have to come masked. So just wanted to make sure that if I'm green, that doesn't mean I don't have to be masked. So if I'm green, I'm good to come to school and follow the school plan. If I'm yellow, I might have some low-level symptoms. Those symptoms are going to be updated, I think, in the next couple of weeks. So that symptom checker hasn't been updated since October 9th of 2020. So we're expecting to see that updated before school starts. So if they have a low-level symptom, regardless of their vaccination status, or if the individual has symptoms that worsen, so they would technically, in the low-level symptoms, be in the yellow status, and we'll talk about what that looks like. If it starts to worsen or they have multiple symptoms, they would be in the red category. Any individuals in the red category would be asked to stay home, and instructions of how to come back to school look very similar to last year. So students that are designated as green, masks are not required if the green designation at school is, but it's still recommended for all unvaccinated individuals, including those 12 and under. They do not need to wear it outdoors, but they do need to wear it on school transportation. All individuals will complete that home screener prior to coming onto school grounds. It is not something they have to fill out, it's just about asking the questions, how do I feel today? Do I have any of these symptoms? There's usually typically 4 questions that they have to ask to see if they're feeling well. The low-level symptoms that are identified right now are considered headache, congestion, runny nose, nausea, muscle ache, and pains. If a student or individual or staff member is exhibiting any of these symptoms, masks are required. They can still come to school, but masks are required regardless of vaccination status. Anyone that's exhibiting symptoms should contact the nurse so we can document it, but can still attend school. And that is something very different than last year. So if you were exhibiting these symptoms, you were asked to stay home. And the reason why we wanna make sure we're talking with a nurse is because we wanna track that, especially if we're gonna head to a rapid testing later on. Individuals will notify the nurse if there's any additional symptoms or if it worsens. High-level symptoms include vomiting, diarrhea, cough, shortness of breath, difficulty of breathing, new loss of taste or smell, sore throat, chills, or fever of 100.4 or greater. Any of these symptoms, we would ask that you, just like before, contact the nurse for documentation, but they can still access learning through a remote option. Individuals will keep the nurse apprised of their symptoms and contact their PCP regarding next steps. These are very similar to last year in terms of returning to school after an illness. So typically we have folks that go to see their PCP. They either get a diagnosis or they don't get a diagnosis. So if they get a diagnosis, whether it's like allergies or things, they may return once they have a doctor's note and are fever-free for 24 hours without the aid of medication. That is a practice that we had prior to COVID, and they should talk to the nurse prior to coming back to school. If they were given no diagnosis, then all these 3 criteria need to be met. So 10 days have passed since the onset of the symptoms, 24 hours have passed without a fever, without the aid of medication, and improvement of symptoms. Sometimes when you see your PCP, a COVID-19 test is taken. If a negative test has happened, then doctors know test results. And if you're fever-free, you can come back to school. If you have a positive test result, then the CDC gets involved and has you do your 10-day quarantine. We suggest that they stay home, hydrate, get rest, and isolate. If a student or staff member is deemed a close contact, if they are vaccinated, they must, we are not asking for folks if they're vaccinated or not unless they're a close contact. And that was the same practice as last year. If they're deemed a close contact, they just show us a copy of their vaccination card, and they don't have to quarantine at this time. It is recommended, even if you're vaccinated, to take a COVID test 3 to 5 days afterwards from the last day of exposure, and to monitor their symptoms for 10 days, but they can still come to school. For individuals that are non-vaccinated, that person is going to have to quarantine for 10 days. Again, it's recommended that they take a test 3 to 5 days after the last day of exposure, monitor the symptoms for 10 days. They can still, if they're feeling good, attend school remotely by accessing the learning platforms from home. What that learning looks like will depend on the grade level. It's not part of the plan, but each leadership team at the different schools will come up with a plan and share with parents what that access to remote learning looks like. It does look different depending on the different grade levels. Traveling, Andy and I would put out a letter every single time a major holiday or break would happen. We usually follow the current guidelines from the CDC, so we will continue to do that throughout this year and update parents what the guidelines are if they are choosing to travel either domestically or internationally. So this is what kind of the color code system on our website will look like. So this is Oak Hill High School. This is what the color code, if Oak Hill is green, yellow, or red. So our dashboard will look a little different on our website this year. Each school will be listed with the color designation as you see on the right. Each school will have that vaccination percentage that we will be sharing with the CDC and DHHS. And each school will have their positive case with dates listed. So just like last year, I put in the date and the positive case. That way parents know when the 10 days start. The only difference is we're not numbering how many close contacts there are. Because if by doing the 6-foot bubble, we're gonna get to lower numbers and we don't wanna get to identifiable pieces. A breakdown of cases I did by month last year. I will continue to do the breakdown of cases graph by month so we can compare our COVID cases month by month. So data will be coming as early as September 1st of how much our staff, where our vaccination stats are. And that is it for my presentation. And questions or discussion?
All right, so I guess the discussion I would have is, what is, so this is the recommendation of the CPT. Are there changes there between what it was in the spring?
So
Just to highlight what the change for people who know what the one was, what is actually changing from that plan?
yeah, so, I guess a couple of things. One, we're not a hybrid. We're either full in or full out. Our color code system is different, so, and that's kind of like our best way to move from the hybrid, situation to get kids in as much as possible. The mask piece of giving parent choice in the green category, where before it was masked all the time. So we're trying to give some, when our cases are really low, to give an opportunity if parents so choose, or staff members so choose, to not have to wear masks. A big difference too is that we're offering rapid testing. So instead of sending students home symptomatic, we are actually giving them a rapid test and then making sure that they might just have allergies or they might just have a cold, and they can still continue to go to school. So I would say those are the major changes from our plan last year.
I think also to add to that, the CPT team does not recommend we take on pool testing at this time. That was actually unanimous. I will say, the CPT team did vote on this plan. It was not a unanimous vote. It was a 12-4 vote. So I think you need to know that. There were varying reasons why people were not in favor of it, but it was a majority vote, 12-4.
Right, and that was, I think, only on the universal masking versus parental option. So it is recommended that students mask when they're vaccinated or not. It's just not mandatory unless we move into a yellow situation. So it comes down to, hopefully those that are unvaccinated, we're asking to wear masks. And I hope that they follow that guidance. It is not one reason why I voted for universal. That's really easy to go and tell kids mask or not, or should be. Doesn't matter, they should be. But when it's just their option and we don't know if they're masked, the teacher doesn't know if the students in their classroom are masked or not, or vaccinated or not, so whether should they have a mask on? We don't know. So I guess basically it is the Wild West with masking going on in the middle and high school where there are age able to have vaccinations, the lower grades, there is no vaccination for them, so we know what their status is, right? So this is the plan for fall that was approved by the CPT to come back for the board approval. And once the board approves it, or I guess we're now in 7.2, having gotten the update. Once the board approves the plan, they modify it or not tonight on what was presented, then that information will be distributed, be put out and distributed to all the community, all the parents, all the stakeholders, staff, and everybody that needs to have it, so it can be referred to and be ready to be implemented in less than a month's time when we're back in school. All right? So if any board members have any comments or questions about the plan, Robbie?
Yeah, I guess, Kathy, are we saying that unvaccinated students in the plan should be wearing a mask?
It's recommended but not required in the green
But
category.
but our plan says that they don't have to wear a mask.
Correct.
They're not required
They're
to.
not required in the green
Okay.
category. Once you get to yellow
Right.
designation, it
Right,
is universal mask.
everybody has to mask with yellow,
Yes, except for on the busing.
right?
Everyone has, if you're riding our bus.
So the plan is not requiring anybody.
Right, to wear a mask, that was
Recommending
my
they do.
point. We're
Yes.
just recommending that unmasked students which would right now be anybody under 12.
Correct.
Well, you
Or
can't get a
unvaccinated.
vaccination if you're under 12.
Right.
So everybody under 12 the plan recommends that they wear a mask.
Yes.
Okay,
It recommends that all students wear a mask, but there's a little distinction between those
Right.
vaccinated and not.
Right, and that's how we ran summer school. So
Right.
the last 2 sessions of summer school, students wore a mask on the bus, and then it was recommended if you were unvaccinated to wear a mask, but it was parent and student choice.
right,
I will say in our pre-K-5 world, about 95% of our students did don a mask on the bus and took it
Mhm.
off during
Right.
summer school session. Just so you can see what the choices were.
right.
I think it's important to note too, this still, I mean, we voted on a plan to be in person 5 days a week
Right.
in June. And this doesn't change that, this just adds on to it, this mitigation.
Joe?
Yeah, so if student one has a positive case, he's out for 10 days. We're still green. Student two on day 7 tests positive, we go to yellow for 3 days.
So the 10-day is the last day of exposure. So if a student tests positive, it's when it goes by their symptoms, when they started symptoms and the exposure. So there are some that are gonna overlap, so yeah, there might be some that are 13 days. However, it's not on the day that you got your test, it's the day you started symptoms. So sometimes people get tests 3 to 5 days after they're gotten symptoms, and so we're already like halfway done the 10 days of the last day exposure. So it's case by case of when that 10 days is, but when we put it on the dashboard, we'll have the update of when the 10 days would be up, and then re-looked at.
I can see where it's a little confused, because I would think it would be updated daily, it would be a rolling 10 days.
Right.
And once you're in the 10 days, you had 2 or more, you go to yellow, 2 or 3. But the next day, you could be back down to 1,
Right, that's.
right? If you went to 2, the next day you could be to 1, because the first one is now past the 10
That's
days.
10 days.
Yeah, sometimes, working with the CDC, each case is case by case, and, sometimes if someone's asymptomatic, that is a different, like 10-day marker than if someone was symptomatic. So that's why the 10 days, we'll just keep it updated on the dashboard and try to continue to communicate with parents.
So I guess my concern would be knowing that this is a constant, fluctuation, as shown by the example they just said. What are the manners in which we are going to communicate this to, families and the community so that we're not constantly trying to chase whatever the requirement is?
So I think the nice part about the color code system is that we can just communicate that. It will be sent out on the first day plan, it will be on the website. We were sending out, it felt like communication
all the time.
daily on positive
All the time.
cases. So this would probably reduce that, because then we just say, here's your case for the 10 days, here's what you do. Really, we're saying the only difference from the green to yellow is mask time. If for whatever reason we got an executive order that tells us that we're masked all the time, then we would just be in the yellow category all the time until we change that till the CPT, reiterated a different plan.
Let's don't worry about that, but I guess, the real point is how do we let the parents know that
Right.
in the morning when the students
Right.
come in, that they're now yellow?
Correct.
We give communication right now through Infinite Campus, we've been doing that, and similar to when we do contact tracing, we contact them and let them know when their 10 days are up, so.
Yep, and it's pretty efficient within the campus. I can push out, I can push it to emails, inboxes, and phone calls, and actually we now have text messaging capability as well, so I can all roll through there. It's pretty efficient.
Okay. That was my biggest concern, is with things changing so quickly.
Right.
Yeah, Kathy, when it comes to vaccinated and unvaccinated students quarantining for close contact, vaccinated students, let's say at the high school, wouldn't have the quarantine.
So once they show us proof of vaccination,
Right.
they don't have to quarantine.
So what about if they get if unvaccinated people get the rapid test and they
So-
don't show a positive test?
That's what we're suggesting, is that a close contact would wear a mask, monitor symptoms, and 3 to 5 days. If the parent allows us to do the rapid test, they
Right.
can continue to come to
But they
school.
could continue to come to school with a mask on.
Correct, and we'll
Okay.
just monitor them. but we're gonna reduce that amount because we're in the 6 foot.
Right.
6 foot bubble.
Right.
I guess I'm just saying, so if an unvaccinated student is close contact, they can come to school wearing a mask until 3 to 5 days after contact, and they can get a test, and then we decide whether they're in quarantine or not?
The test does.
The test.
Yeah.
So, but during that period in between, they're
Correct,
gonna be in school.
correct, just like.
So it's not
closest.
like they have to go out of school for 3 to 5 days and
Right.
get tested.
Correct.
That's my question.
We're running it just like a protest.
Right.
Keep kids in school
Yes.
as much as possible.
Right, I just don't want kids in school that are going to be able to pass it on.
So I guess my next question would be vaccinated students that are close contact, will they have to wear a mask and get a rapid test? Because you can still
It's
catch
still
COVID.
recommended, so
Right.
recommended or required, it is still recommended that they would get a test after 3 to 5 days of
Okay.
exposure, based on CDC guidance.
Right.
If they're showing no symptoms, they would still be in the green category.
Right.
They wouldn't have to wear a mask if the school's in the green designation as well.
Okay.
And we're going to let staff members know which students that are close contacts are unvaccinated so they can be wearing masks? Is that
Yes, so-
information we pass to our teachers?
Yep, our nurses are really good about letting, when students were identified as close contact, they got the list, they got the date of when they could come back, so that all students, knew when they could return, and then staff knew who was gonna be accessing remote learning, or who would be wearing a mask.
Okay. Scott, you want to say something? I tell you, you're pulling the microphone
Well,
over
I'm
closer.
I find a lot of holes in this plan. They were a much larger district, right next door to Lewiston, decided not to have masks, just have it mandatory. They're a much higher population school. RSU16 is similar, Poland, Mechanic Falls, Minot, same situation there. We're talking about the least vulnerable of our population. These kids recover so fast from this. My kids got COVID. They were sick. They got a fever. You give them some ibuprofen, send them to bed, next day, perfectly fine. I'm not aware of any deaths of any children from COVID in the state of Maine that attended school. This is crazy, right? Designating kids that are different colors, maybe we should just give them stars on their chests. This is absolute insanity. I hope we can maybe come up with some changes to the plan. I'm not totally against it. If we see complete outbreak levels, maybe it's time to address it. But we're talking about some pretty small numbers. If I heard correctly, going into yellow is 3 students. Seems
More than 1, 2 to 3.
seems low. Just violating people's personal privacy about testing and just, there's all
Well,
kinds of
that's
insane.
with permission, test only with the
I
parental
understand,
permission.
I understand, but requiring tests to come back to school, this is just insanity.
No, you don't have to have a test, like you can wait till 10 days.
I understand.
You have an option.
I heard the presentation.
Just want to make sure that people out there that are
Yeah,
listening.
I want it to be known
understand
that my
that
stance
it's
on
not
this is
required.
100%, this should be optional.
All right, thank you.
And I think I'm on the other end of the spectrum, to be completely honest, particularly with pre-K to grade 5, knowing that they don't have a vaccination option at this moment. It just leads to confusion in terms of what's expected of them. When I think about pre-K, kindergarten, I have a first grader, if they see their friends not wearing masks, I'm not sure what they'll do. You know what I mean? Even though the CDC, the American Academy of Pediatrics are all suggesting that if you're not vaccinated.
And I think that's my concern as well, is like, could you imagine being a pre-K student on your first day of school, or even a week into school, just coming into a sea full of masked people?
They did it last
They
year,
did it
had no
last year.
problem.
My grandson
We
did
don't
it
know
last
the
year.
long-term effects of how that's gonna affect their mental growth.
All right, we don't want to get an argument back and forth here.
Okay,
This should
I
be-
just want to point out, there's 24 people in this room, there's one person masked. I shook several hands on the way in. I'm more prone to having lasting effects from COVID than these children are.
And that's your decision, and you will live with the results if you should suffer from it.
Okay.
I mean, that's, so, but this is the
I've had
plan.
it, and I've had worse flu, and,
Okay,
okay.
that's fine. So
I don't
this,
see you wearing a mask, like,
I have it in my pocket, I was gonna bring it in, I looked at the layout of the room, I am fully vaccinated. I don't believe that I'm carrying it.
But we didn't
And I
test
thought
the
about it
door,
real
so
well, you know,
any
I
number of
thought-
us could be carrying it tonight.
I know, and I have it right here, and I brought it along, and I wear it when I go into the grocery store.
But I could pick my kids up from school and I can go to Walmart where there's dozens of unmasked people. How does that mean they can't get it there, but they can get it at school?
We're not
Let's be
responsible for
realistic
what
about
happens
this.
in Walmart, we're responsible for what happens in our schools.
That's correct.
Okay, so, to get back to the discussion here is on the plan. Are there any other comments before I open it up to the community members who may? Robbie?
I have a question about the individual level, Kathy, yellow. I think leaving that interpretation, everybody's gonna interpret their kid being sick differently. I mean, we've all been in schools where kids come in sick, right, Vicki? And they should have never been there, and the parents, when you call them up, they say, well, they weren't sick when I let them go. You know, so I think that yellow designation is gonna be a lot of room for kids coming in sick.
Can we maybe get some sort of doctor's note ahead of time? My son has allergies. I mean, his nose is running 4 out of 5 days. So based on the very first, second bullet point, congestion and nose running, he's gonna get sent home potentially for that and have to go through a COVID test. I mean,
No, so they won't get sent home in the yellow designation, we're just asking that if you're exhibiting any type of
Right.
symptom that's a low level, you'll be wearing a mask at that point,
Right.
to make sure that you're not spreading, whether it's cold, or if it's allergies. We can't tell as educators, we're not ECE.
So my point being is, if somebody does have allergies,
They would still be wearing a mask.
they
if
should be
they're-
wearing a mask when they come to school.
Correct.
Okay. All right, so at this time, I will open it up for comments from the floor on this. I ask that your comments be to the point and not long speeches by anybody from either side of the argument or any side, or people who have questions. We certainly encourage the questions. We would like as much understanding of the plan by the community as possible, so that when school starts, there won't be so many questions left then, when the bus ride home at the end of the first day and everybody's got questions. So if you would raise your hand or send a message in the chat, we will call on you and entertain your comments.
So we have one person in the Zoom has their hand up. It's 6'3", somebody labeled 6'3" 5547.
So if you'd identify yourself, please, and which town you're a resident of. Okay, hold on a second, we gotta get our speaker system working here.
I've got to, Heidi, hold on just a sec, our audio is not, there we go, try it again.
Good, okay. Heidi Black, I'm an employee and a parent of 2 kids that went through the system. And I have to say that I commend you all for all the great hard work that you're doing. It's definitely been a challenging year and a half or so. And I look forward to continuing working with you and your collaboration. I think you all are doing a great job, so thank you.
Okay, thank you. Any other comments? We're not seeing any coming in the chat or raised hands. All right, then we'll pull it back in here for any last minute questions about the plan before we vote to approve it, because it is a change from what we had approved in the spring. And the points that were changed have been highlighted. All right, so that we can get it out. Any other last comments?
I want to commend the CPT team for all the work they put into this. I'm glad that parents are being given the option for their children to wear a mask
Can I ask one question? Do we have the ability to provide pre-existing conditions so that we're not gonna run into issues going forward before the school year?
That would be up to you.
Meaning, am I able to provide a doctor's note saying that my child has allergies or IBS or something that's gonna show up as a symptom? So they're not.
And I would say that's up to you guys. So this plan is recommended by the CPT. You as a governing body of the organization have the opportunity to make changes to it, throw it out and ask us to go back to the drawing board, or approve it as it is. So I think that's a discussion, if that's something you have, you can have that.
I guess I'm just curious if you're asking that question so the child doesn't have to stay home or the child doesn't have to wear the mask, because if they're exhibiting symptoms in this plan, they would be showing the mask, but they wouldn't have to stay home. So
Wearing a mask, so yes, if my son pets a dog on the way into school, he's gonna have a runny nose when he shows up. If the nurse has on file notes saying this child has allergies, he's not exhibiting any other symptoms, is it required for him to wear a mask?
So it would be up to the board to make that amendment.
Right, I don't know if other board members want to speak to it, but I'd like to bring it up, is I understand the situation. But as educators, when they come in the classroom, we don't know if that runny nose is because of the allergy or the runny nose is from something else. And in order to protect the staff and students that are in the close proximity of that student, to ask them to wear a mask while that symptom is presented, I don't think is a real burden. And I think it is a safety measure that, while we didn't address that in the CPT specifically with allergies, the fact that, we know kids are gonna come in with colds.
Are COVID patients no longer possible asymptomatic?
Trying to address your concern about the allergy and exhibiting symptoms and where they have to wear a mask. My position is that we take the plan as it's been presented and go forward. Every plan is a working document. Things have to change in it, it will be addressed, recommendations will be made back to the board will discuss it as we did tonight, and then make its decision on how we want to go forward in what we want to implement. So my opinion, just mine, I got one little vote, is that we don't make that modification, because I'm not going to ask the building administrators or school nurses or teachers to go and make a determination, is that an allergy or is that COVID?
We would present that information to them ahead of time, often.
Just because they have allergy doesn't mean that day it's an allergy, that's what I'm
That's
trying to
right.
get across.
That's
So,
right.
So, just for clarification purposes, typically, exactly what Scott is saying, the school nurse will know, because they have on file students who have various allergies and all other health concerns. To clarify the process, if a student comes in, they're coming off the bus, they have a mask, whether they've patted a dog or not, if they're exhibiting symptoms, they're gonna have a mask on their face. Is their first stop, check-in of the day, if they're wearing a mask, are they going to be going to see the nurse?
No, I mean, a lot of times our parents will contact the nurse, just let them know, or they email their teacher, just let you know that, Johnny is not feeling good today. And we'll continue to encourage the mask wearing and hand washing and things like that, regardless of what the symptom is or the why. We did have students with allergies last year that were allergies. We did have some that were allergies and turned into COVID. So we just are asking for mask wearing if you're exhibiting any symptom, for the any why,
Okay,
in this plan currently.
yeah, thank you.
Bobby?
No, I agree with the plan, and I was talking to Andy today, and I mentioned the fact that if last year at this time, we had told the community, we're going to school 5 days a week and your kid has to wear a mask, but they can go 5 days a week, I don't believe there would have been hardly anybody that complained that they were in school 5 days a week wearing a mask. But because I think this plan is great. It's giving us an opportunity to bring kids in without a mask for as long as we can. And like I've said in the past, it's only gonna be as good as the community makes it. That's it. So we're gonna try to stay in school for as long as we can without a mask. But if we have to go do it, we're still gonna be in school 5 days a week. Every student that we can keep in school, we're gonna try and keep in school.
So if there's no other comments, then I would entertain a motion that we approve the fall opening plan as presented tonight.
So moved.
Second.
Moved in second. Any further discussion? Seeing none, I'll call for the vote. All those in favor? Yeah, all votes are really supposed to be
Yeah.
weighted votes.
Okay.
Those opposed? That motion carries. Thank you. Item 7.3, discussion of federal ARP funding.
All right, so moving on, as you all know, recently the American Rescue Plan, or you may not know, what's that recently? I just have it. Awarded the school district $3.592 million. Obviously, that was a process. I'm looking at the log on here. You're being temperamental, yes. So, we,
Andy?
yeah,
Can you put a mic in front of,
yeah.
just so people can hear?
Yep.
Thank you.
All right, so the American Rescue Plan, it was the president's pitch to the legislature. Obviously, it went through a couple of different ideations, but it came out, it's entitled the American Rescue Plan, but it's ESSER 3. If you asked me what the ESSER acronym was, I couldn't tell you. But we were awarded $3.592 million to respond to the COVID-19 pandemic. So, and there's just kind of the number, and it's 3.592 and some change. So, they're pretty prescriptive in the way the funds can be used, sort of. And so basically, there's one big requirement, and 20% of that amount of money has to be set aside to address learning loss related to the COVID-19 pandemic. So, when I think about learning loss, I think about curriculum, assessment, instruction, and when we talk about that, I will pass that over to Kathy. Number 2 was coordinated responses with other agencies. So just as a example, we in the past have done some work with the Count Me In folks to increase attendance. It would pay for things like that. Educational technology, so that's programs and hardware to increase our technology across the district and give students more access to technology for learning. I think we've done a pretty good job of that over the last probably year and a half, but obviously we can improve. This is things like we could provide hotspots for students and pay for money with this money. Summer learning and after-school programming, which fits into the 20%. Indoor air quality. So this would include ventilation, LED lighting tied to ventilation, air conditioning, air purifiers, things like that. Health and safety mitigation strategies, so cleaning products, desks, cleaning equipment, things like that. And then any allowable uses under ESEA, IDA, and all those other acts that we receive funding for. So special ed, family literacy, Title I, and Carl Perkins Act is actually for career and technical centers. We don't have a career and technical center, so it wouldn't fall there. So, as part of this, we needed to kind of engage the community, so on July 30th, I sent out a survey to our community for some input on how to use these funds. And so I received 30 responses, which I was pretty impressed with. I mean, typically, when you send out something like this, you never know what you're gonna get. So just, I put some of the highlights here. Indoor air quality and ventilation, summer and after-school programming, air conditioning, technology needs, tutoring, before and after care that is free. And I will caution all of you, some of these are just not, we're not able to do under the rules, but I wanted to highlight them here. High school remodel, internet for families who do not have it, outside learning spaces, health and safety measures, meaning sanitizing equipment, KN95 masks, tax relief was one. Although, as I said in my letter, we couldn't use it directly for tax relief. That would be nice, we always like that. Social emotional learning, middle school expansion, testing equipment, COVID education to dispel myths, air conditioning on buses, new lighting, and fixing the parking lots. And I will say, I was really impressed with the thoughtfulness of the responses that I got. They were pretty, if anybody actually wants to see them in total, I have them. They were pretty good. So one of the things that we've done, we've talked about in the past are some projects that actually would fit under this money that I think are really important. First off is an air handler unit here at Oak Hill High School. So as you all are aware, Oak Hill High School was built in 1976. The air handler unit, specifically the one to the gym, is original to 1976. It meets the requirements, but it is old, it is inefficient, and it needs to be replaced. That's a $600,000 price tag to do that. That's a big ask of our taxpayers. This is an opportunity for us to use federal funds to pay for it. I have some money in RSU4 funds left over that I have earmarked for a project like this. Some of this money would be used to supplement that to get a project like that done. An LED lighting project. So we've done 2 performance contracts in this district. The first performance contract addressed ballasts. It did nothing with LED lighting.
Right.
The second one didn't either. So this project would be at Cary Ricker Middle School and Oak Hill High School, with the understanding that down the road our plan is to close Libby Tosher and Savannah's primary. We need to do this project regardless, and I'll tell you why. This represents immediate $70,000 a year savings in electricity, just in those 3 buildings. Now, if you have to put that into your budget, $70,000, it's about a 10-year payback. This money would allow us to do that. The question is, why lighting? Well, the lighting that we're looking at would be tied to the ventilation system. So when the light clicks on, it would tell the ventilation system to start the air exchange in the room. It's a very new technology, and it's impressive to see. So if somebody walks in the room when it's occupied, fresh air is coming in automatically. Nobody needs to worry about the setbacks or anything like that. It saves you money with the lighting, but it also saves you money with the air handler units not running when they don't need to run. Camera system upgrade at the high school. So with some of the other COVID funds, we did a camera system. Cary Ricker didn't have a camera system. And so because of contact tracing, we needed a camera system there, and long term, we needed a camera system in that building, so we used some of the COVID relief funds early on to do that. The system here at Oak Hill High School is old. It is inefficient. Marco can tell you it's very difficult to use. It's hard to remote in if we have an issue. Actually, I don't even think we can remote in anymore, can we? The server is that old. And so we could use this money to upgrade this camera system, which we need to do anyway. And instead of having the taxpayers have to pay for this through our budget, we can use federal money to do that. And then learning loss, and I'll turn it over to Kathy to talk about, process for that. So that's about $720,000.
Yeah, so we're definitely excited about our success of our comprehensive summer school program this last summer, and we're looking forward to continuing that. So using some of that money as our community members have asked. We are not necessarily in a rush to spend this money. We have a little bit of time, 2024,
Yep.
I believe.
It has to be spent by September 30th, 24.
So we do want to take a pause, and I don't like the term learning loss. That's my own thing. I do feel like we need to find out where our kids are at. So we have students that were fully remote, we have some students that were homeschooled and are coming back to us, and we have our students that are hybrid. We really need to know where they're at, and then work with our staff to figure out where our needs are, and then figure out what our programming is. So we will have a process of finding, assessing our students, working with our staff of what skills do the staff need to teach to kind of close the gaps and accelerate our students forward. What support do they need to do that? And we'll have a process to kind of get information from our staff, and that will go to the the CAI team to kind of talk about what that learning loss money could go to.
I think it's important, this application is due at the end of September, so we have some time. Kathy hits the nail on the head. I'm not in a rush to spend all of this. I think, ultimately, we've got 3 years to expend this. There are going to be things that come up. It is a lot of money. It just is. And when you get money like this, everybody's eyes get real big. Like, ooh, what can we do? For me, it's really about what makes sense for today for our students, but also long-term. How can we invest in our infrastructure here so that it doesn't impact us, budget-wise in 10 years? For instance, I think you all know, we got other COVID relief funds. I'm really impressed with the work that we did to spend that money to reduce impact on future budgets with things like buses, with things like cleaning supplies and cleaning equipment, and things that we now have in stockpile so that we could make adjustments to our budget for long-term instead of having to ask the community for more and more money. I think that's key. I say it all the time, you guys have heard me say it. We are a different RSU than those that neighbor us. The majority of what we ask is on the backs of the property taxpayers. So anytime we can use federal funds to reduce that, I'm all for it, and that's important. We bring this here. I didn't know if anybody else had some ideas, if we wanted to talk about it some more, but I think it's important. Do need to get this application done. That doesn't mean it's set in stone. Just like our other grant funds that we get, we can adjust them along the way. We can ask for changes, things like that. But I do have to have something submitted by the end of September. Basically, and the other piece that I'm looking into with this is potentially paying for the architect. I can't get a straight answer on whether or not, so I'm working on that piece. I don't know if that will be the case. I can't promise that, but if I can somehow work the architect into this package, I would like to do that. It's unbudgeted for money. And so consequently, if we can get the federal government to pay for the architect, I'm all on board with that. So, I don't know if anybody has any ideas.
I have a couple of comments.
Yes,
or ideas. I think one idea, when I was speaking with other parents that are in the district, when the survey came out, people don't know what options are. So if there are really great options that other states have used or other districts have used, maybe giving people kind of a list so
Yeah.
it can generate more
Sure.
ideas. My second idea or thought goes around kind of professional development for our teachers. I know in looking at previous budgets, there hasn't been much earmarked in terms of being able to encourage master's degrees and other post-secondary education. So if there's ways to align teachers' PD with learning loss and new innovative ideas, I think that could be a really awesome opportunity.
It is, and that's something Kathy and I have talked about, what kind of professional development can we offer, or can we let them do it? And again, it's all about, to be candid, federal grant funds are somewhat of a game. Like with these, you have to tie them to COVID-19, you have to find a way. Scott and I and Kathy will sit around and talk about, okay, we need to do this, how do we tie it to this? Where's the connection here? It's difficult at times, but I think that's a great idea.
Other comments?
So there have been conversations in the past about potentially, we've done a lot to increase the bus fleet with this,
Yeah.
but what about vans?
So,
Because I know that we had talked about that previously as well.
so currently we have a fleet, how many vans do we have now?
4, I think.
4 vans currently. We have looked at purchasing more vans, but they aren't right at the moment.
Well, yeah, I know.
That's part of the
I
problem.
know.
And honestly, I'll be candid, I like having the vans. Part of the problem is you have to also have somebody to drive them.
Right.
But they've been very beneficial with things like golf and wrestling and
Yeah.
field trips. Instead of
Yes.
running a great big bus and a bus driver, our staff can drive the van. It can take students, the coach can drive the van and take students. So that's, I mean, we use them, Scott, they're out all the time. I
Absolutely.
mean, not last year was very different.
Yeah.
Right.
But in the past, they've been out all the time. We've had a lot of conversation about increasing that fleet. One of the things that's really hard about, every time you increase the fleet, you also increase your maintenance costs.
Yeah.
But at the same token, if you're not paying for the vehicle, then there's a way around that. So you're right, I mean, I will tell you, our bus fleet has never been healthier. We have talked for years about the health of our bus fleet, and we kick it around every year. How many buses are we gonna buy this year? You know, we are at a place right now where we're beyond actually our replacement cycle. And so, how many new buses do we have coming next month, October, I guess?
4.
4 new ones, that we didn't have to pay for. The federal government's paying for them. So, you know, those kind of things, and eventually, you know, we've talked in this district at times about moving to one bus run. Now granted, you have to have people to drive the bus. That's a difficult thing right at the moment. But, you know, as our bus fleet expands, that could be a possibility. But until that point, my concern is putting safe, healthy buses on the roads for our students and for our drivers to drive. And so we've done a lot of that. But it's a great, Scott and I talked about, and Glenn have talked about this a lot, about getting more
Yeah.
vans. We have 3 10-passengers and a minivan currently.
And
And
we
just being able to rotate buses out
Yeah.
and
It's
save
huge.
mileage
It's huge.
is a big plus.
Yeah, we went looking in May and June for vans.
Yeah.
I mean, all over. And it was either a premium price or
Right,
none at all.
yeah.
Right. It just provides a lot more opportunity for small group learning
You got
to
it.
be able to go and do different
Absolutely.
things regardless of what age. So it would be nice if we could do some of that.
And it's hard to run a bus if you don't have someone to drive.
Right.
Right.
Yeah.
You know,
Right.
you know,
And with
consequently,
the shortage of drivers, every time we're taking a field trip,
Mm-hmm.
we're short a driver on the regular runs,
right,
Yeah.
right.
or sports,
Right.
or
Right.
whatever.
Yep. So, I mean, we had a couple situations this spring where baseball took 2 vans,
Yeah.
you know, because we didn't have a driver.
Sure.
And so consequently, if we don't have a driver, but we need a bus, we end up contracting that out. Well, when you contract out with Northeast Charter, $800 to $1,500. This way, we were able to use the vans and not expend those funds. So, vans are a win-win all the way around. The other thing is, we do a significant amount of out-of-district transportation. We have a local transportation
Yeah.
company that does that for us at a really nice price. However, there was a potential last year that they
Yeah.
could have folded.
Yeah.
And so, you know, that's always a potential in that industry, and so having a fleet of vans to be able to take over, because we have to transport those students, we don't have a choice. So that, we've been trying to build that fleet up as well.
Other comments, suggestions?
At our previous board meeting, we talked a little bit about ventilation, air conditioning,
Mhm.
heat pumps.
Yeah, so we did some exploring. I almost had a heart attack when we explored air conditioning. So we called Siemens, we work with the Siemens Corporation. So I started with just central office, right? Just to see, it was $330,000 to put air conditioning in central office. We then talked about Kerry Ricker, Scott, 1.8 million.
1.8, yeah.
1.8 million to do air
That's what I
conditioning
mean.
at Kerry Ricker.
Yeah.
The middle school was about 1.5. And Siemens wouldn't even quote this building. The engineer
No, it's
wouldn't
not
quote the
built
building
for it.
because it wasn't built for it. Yeah, I know, because that was where my brain went first, air
Exactly.
conditioning. Now, I will say, the middle school is built for that. When we
Yeah.
do the addition, that will be the time to include that in that project. But, you know, we could look at air conditioning for Kerry Ricker, but it would eat up most of this.
But wouldn't it be a benefit for our summer program?
Oh, it
Yeah,
absolutely
absolutely.
would.
Right?
That's why we started looking.
Yeah.
Yeah. One school to your complete summer program.
When we built the middle school, I tried to get air conditioning, and it was an extra
You
$250,000.
couldn't even get a refrigerator.
I know. But,
It took us.
but the system, that system is new enough so you can add coils to the air handlers to make air conditioning with the system that you have in place. So,
Think about that with inflation, so when the middle school was
Yeah.
built, 250,000,
250,000.
now we're talking $1.5 million. Yeah. And part of that is, and one of the things the engineer did say to us was, call us again in 6 months.
Yeah.
Because, you know, the cost of materials is so high right now.
Right.
You think about the cost, just the cost of lumber alone. It's the same conversation we had with the architect. The
Yeah.
architect said, you know, we're gonna do this, but let's not get ahead of ourselves, because the cost of
Yeah.
building an addition right now is far more than it may be in 6 or 8 months when the supply chains get better.
it's hard to believe, but steel right now is cheaper than lumber.
Yeah.
Right, other comments? So my thoughts are, I believe that, I know you don't like the learning loss, but we know that over summer, students all suffer some learning loss. And because they were remote most of last year, at least half of the time, the loss was probably greater than it would be in a normal year, just because the learning probably wasn't it was as good as we could make it, but it might not have been as good as it was 2 years ago or a year ago before we had the COVID. So I think, and it's my understanding, we have to explain our application where we're gonna spend this money. So the 1.9 that's left over from administration's plan, where that money would be spent, if we agreed with those 4 items up there, that's where we wanna go and stick the money. We're gonna find out where our students are and what support. I hope that we would stay open to using support mechanisms to help the students go and learn. You know, I'm a big proponent of offering classes online, having done that in college. You know, it was kinda nice, either I had to go in a classroom and just ITV it there, or I could do it at home. I even took some on VHS tape when I was in Scotland. No place around. So I think that students that are motivated can look at certain subjects and would be able to find a for-profit organization out there that for years have been developing curriculum and online presentations to allow them to get it. It's also a good avenue for those who, maybe I'll just take algebra, took algebra 1, but passed it, but they don't feel that they're that strong, and they need some support to be able to go and take kind of like a refresher or an algebra course online. There's no risk to them, because they don't really have to get a passing grade. It is to bring them up to speed. And I think that that is a lot of what this money is to try and do, is to get the students, get them back up to where they should be and solid in their different subject matters, so that they can continue to be successful as they go on. The last thing that ever works is to take a student that's unprepared for the next grade and put them there, because they're never gonna be prepared for that grade or the grades after. And, so we need to really use some of this money to provide those types of support. Go out, get it from people who already have it developed and are doing this and have done it for years, instead of trying to build it all in-house, because that takes a lot more time from the staff to go and have to do that, plus their normal duties. And that's not what they trained for, and it's probably not what they wanted to do, was to go and build online curriculum, you know. So, I would like to see some effort put into that, and, to use the funds. That's why they have 20% that needs to go into those type of areas, so. I think your items up here, that, air handler is only for the gym?
So 600,000 just for the gym area.
Yeah,
And it does other things, but its
Yeah.
main purpose is.
Well, that's 235,000.
Right.
well, that's from the SFU.
I have other funds, SR2 funds.
So that 235 would only go towards the gym.
Yeah,
Yes.
And we don't- yeah. So, we don't need air handlers in the classrooms?
Well, we've replaced the univents, we've done a lot of that work
Right.
already.
Right.
So to do all 3 air handler units in this building, it was almost $2 million. It was unbelievable.
Yeah.
So what Siemens said to us was, The first priority has to be the one in the gym, it's the most inefficient, and it doesn't just feed the gym, it feeds other parts of the
Yeah.
building as well.
Okay.
Yeah, its main
Right.
purpose is the gym, but it was
It's
2
the
million.
administrative offices
Yeah,
and that
and
whole
The cafeteria,
cafeteria.
the kitchen, where else, I can't remember, Scott, it was,
Say it again, I'm
the
sorry.
air handler unit for the gym is like 4 different places. Gym, administrative offices, nurse's office, this whole lower
The whole
part.
back, yes.
Yeah.
Okay.
Yes.
Because that's a
But-
lot of
but
money
it's-
just for the gym.
Well, it's a significant amount.
Yeah, it's a
All,
big unit.
whole project was unreal.
What about air pumps? I mean, they produce cool air as well, and
Yeah.
I don't know if there's rebates available for,
Yeah, there are.
There are.
I know there are,
Yeah.
you know,
Yeah. And-
residential based, but.
There are, we have talked about heat pumps, we talked, like, for instance, at central office, we talked about heat pumps. And Siemens is looking at that to try to put heat pumps into these buildings, we actually have some,
Yeah.
like the main office here.
In the computer room,
The computer room,
server room.
the, library are all have heat
Yeah.
pump technology. Most of our buildings have some, other than Libby Tozer and Sedatus Primary, have some heat pump technology in there.
And probably offset the heating costs as well.
It does to some degree.
It does to
Yep.
some degree.
Yep,
It does.
yep.
Yeah, so the cost of putting heat pumps in shared classrooms or something, I don't know. That would take, you know, instead of getting central air, like the heat pumps is a good idea to
Yeah.
look into
Yeah.
what the
Sure.
cost would be.
Yeah.
Especially if we make some rebates.
Yeah, and I don't know what rebates are available for businesses.
I don't know. I'm not sure.
Yeah.
I know in
We're
housing,
looking-
it's like $1,400 per unit, but one unit can do 3 heat pumps depending on the size of
Sure,
the unit, so.
something certainly to
If
look
you're
into.
talking classrooms, they would handle classrooms.
Yeah, that's pretty small space,
Yeah.
relatively speaking.
Another idea.
Another idea.
That, yeah, this is what happens. What if you use funding for mini grants for high school students to create after-school programs for our younger students?
Interesting idea.
Specifically, like, focused on content area. That way, when I'm in my profession, working with older kiddos, it gives them a chance to kind of explore that mastery. So not only are little kids learning and kind of seeing and mentoring bigger kids, the little kids get to learn some new skills too. And that could be a cool way to get students involved. Yes.
All right, so there's some ideas, we have some up here. I think I would like to kind of keep it open until,
Mhm.
I mean, you could start working on it and working on the shell of the,
Well, and what I typically do with things like this, so I will take projects that we currently have, I will put all the money into them, and then when we have new things that come up, I can then redo the application. I can have the application reopened, and we can make changes to it. So it doesn't get earmarked. It has to be earmarked somewhere, but it doesn't, we wouldn't spend it there
okay.
necessarily.
If you stuck up a slide before this where you got the community input,
Yep,
and just briefly, which ones on there could not,
yeah, so,
Actually,
aren't eligible?
So high school remodel, I don't know about COVID education, middle school expansion, maybe, it's gonna be tough. Tax relief, definitely not. Parking lots, we cannot do, there's no way, I don't know of any way I could try to find to do parking lot. I mean, the parking lot here at the high school needs to be done, it just does, but to tie that to COVID-19, I'm not sure how I would do that, might be difficult. The rest of them are potentially doable, so,
Okay.
yep.
All right, so keep thinking about it, if you have more ideas, shoot them in. You know, do the survey online, we probably all got the email. If we didn't get the letter from the school, we probably got it from the town,
Yeah.
okay?
I did send it to all 3 towns to meet. I sent it to Kelly. To be
So I-
put out through the Litchfield Sedatus Mills listserv.
And Wales sent theirs out, because I got
I
mine.
got mine.
I'll check into that.
Okay.
Yeah, and, because I suggested that, because I wanted to get as much input as possible from the
Yeah,
community.
right.
You know, and so don't just restrict it to those who have students, all right? Get it out to the other people in the community, they could have some great ideas. So, all right, so that's kind of the discussion on that. We don't have any committee reports tonight. This is an opportunity if any board members want to make comments. this would be an opportunity, we'd open up for brief board member comments.
I'm
Vicki?
just glad we're here together again. You know, I think we're generating so much more being here than in a Zoom. So we just hope this continues.
Right. And to welcome to our new board
Yes.
members.
Yes.
Christie and
Yeah.
Scott, welcome. All right, any other comments? All right, at this time, we're gonna move into executive session. So there is no business planned after this other than the vote to adjourn, or actually, I just kind of move this out unless there's an objection. So if you wanna stick around and watch us adjourn, hang out in the place. But if you got something better to do, like, I'll wait. We appreciate your coming tonight, and,